Welcome to the Culture of Healthcare. This is Nursing Care Processes, Part 3. In this session, we're stepping into the professional world nurses live in every day, a world shaped not by just science and skill, but by culture, expectations, and accountability. We'll explore the realities of working in healthcare settings, what's expected of nurses on the job, how care is organized and delivered within practice settings, the legal and ethical guardrails that protect patients like privacy laws, and the professional responsibilities that guide every action from documentation to decision making. The culture of healthcare is more than procedures and protocols. It's about balancing compassion with precision, navigating regulations while still seeing the person behind the patient, and working with teams where every role matters. So let's dive in and explore how nursing care processes fit into this broader culture and how they shape not just patient outcomes, but the very trust patients place in the healthcare systems. By the end of this unit, Nursing Care Processes, students will be able to identify the settings where nurses work, from hospitals to long-term care facilities, and connect how clinical engineers adapt technology support to each environment. Discuss the procedures that nurses perform and how clinical engineers maintain and calibrate the equipment, such as infusion pumps, ventilators, and monitoring systems needed for those procedures. And identify nursing career opportunities, including those not involved with direct patient care, and explore how clinical engineering parallels this by offering behind the scenes opportunities that still directly impact patient outcomes. Welcome back. In this lecture, we're shifting from the culture of healthcare to the day to day work of nurses. If the culture sets the values and expectations, routines and procedures are how those values show up in practice, at the bedside, in the chart, and in the technology that supports patient care. Here's what we'll explore. First, where nurses work, because settings shape routines. Then, invasive procedures, what nurses do directly to support healing. We'll look closely at medication administration, one of the most high risk and critical responsibilities in nursing. Next, we'll cover documentation, the written backbone of care. And finally, we'll consider technology, which has become central to how nurses deliver safe and efficient care. These routines may look ordinary, but they are anything but. They carry the weight of safety, ethics, and trust. And just as biomedical engineers and technicians bring precision to the devices that keep care running, nurses bring precision to the human side, procedures, medications, and decisions that directly impact lives. Let's start with acute care nursing, the front line of urgent problems. Picture the controlled chaos of an emergency department. A patient arrives struggling to breathe, another is wheeled in after a car accident, and a third waits with chest pain. Acute care nurses thrive in these moments, balancing speed with precision. They work in emergency departments, urgent care clinics, and surgical centers, places where every second counts. They also work in inpatient and skilled medical settings, including intensive care units where critical care nurses monitor the sickest patients with constant vigilance. Acute care nursing is about quick judgment, rapid intervention, and calm under pressure, and it mirrors the mindset of clinical engineers working alongside them. Imagine a ventilator alarm going off in the ICU. The engineer doesn't have hours to troubleshoot. They need to stabilize the device immediately, ensuring the patient remains safe. Both roles demand the same core skill, responding to urgent needs with clarity, competence, and composure. While acute care nurses focus on urgent, life threatening conditions, ambulatory care nurses work in different rhythms. Their patients aren't in crisis, they're managing ongoing issues, seeking education, and often learning how to prevent future problems. Ambulatory care nurses treat and educate patients about non urgent concerns, like managing diabetes, understanding medications, or coping with chronic pain. Their focus is on health promotion, helping patients live healthier lives, not just recover from illness. And increasingly, they reach patients through telecommunication, A phone call, a video visit, a secure message might replace an office visit, making care more accessible. You'll find them in community health centers, doctors' offices, diagnostic clinics, even military health systems, wherever patients need guidance outside the hospital walls. If acute care is firefighting, ambulatory care is prevention, building healthier systems before emergencies erupt. And once again, there's a parallel in engineering. Clinical technicians don't only respond to alarms and breakdowns, they also maintain, calibrate, and educate staff to prevent failures before they happen. Nurses and engineers both know the best emergency is the one you avoid. Long term care nursing looks different from the fast pace of emergency rooms or urgent clinics. Here, the focus is on the steady rhythm of ongoing support. These nurses care for people living with chronic illnesses or disabilities, often over months or years. They become part of a patient's daily life, helping with bathing, dressing, and meals, while also monitoring medical problems and responding to emergencies when they arise. You'll find them in assisted living facilities, nursing homes, or skilled nursing centers, where care is about balance, promoting independence while providing support. Long term care nurses also see the human side of healthcare in its rawest form: patients aging, families struggling, the small victories of recovery or stability. In a way, their role mirrors preventive maintenance in engineering. Biomedical technicians don't just fix devices when they fail, they keep them running day after day, making adjustments so systems remain reliable. Long term care nurses do the same for people's health, preserving stability, preventing crisis, and ensuring safety over the long haul. It may not be as dramatic as an emergency room, but it's just as vital, because in long term care, quality of life is a measure of success. Not all nursing happens inside hospitals or clinics. Some of the most personal care takes place in the patient's own home. Home healthcare nurses, sometimes called visiting nurses, travel to where patients live. They might provide short term care, like helping someone recover after surgery, or long term care for those living with chronic illness or disability. Their work is about more than just delivering treatment. They monitor patients closely, ensuring medications are taken correctly, wounds are healing, and health doesn't slip unnoticed. And because they often see patients in their own environment, they understand things hospitals can miss: how someone eats, moves, or copes with daily living. These nurses may be employed by private agencies, nonprofit organizations, or healthcare systems, but their mission is the same: to bring professional care into the heart of everyday life. It's a bit like engineers who make house calls for medical devices, checking, calibrating, and making sure the equipment works in the actual environment it's used. In both roles, the work feels more personal, more connected, because of the professional centers and the patient's world rather than the other way around. Home health care nursing reminds us that sometimes the most healing place isn't in a hospital bed, it's home. Not all nurses work one on one at a bedside. Some focus on health at the community level. That's the role of public health nurses. Their mission is to promote health across entire populations. That could mean running vaccination clinics, educating neighborhoods about nutrition, or developing programs to prevent chronic disease. Public health nurses also help shape policy. They use data from the community to guide leaders in creating safer environments, stronger health systems, and smarter prevention strategies. You'll find them working in clinics, health maintenance organizations, or government agencies like the Centers for Disease Control and Prevention. In each case, their reach goes beyond a single patient. They touch entire communities. In many ways, they're like systems engineers in healthcare, thinking about the bigger picture, asking, how do we keep the whole system running well? Just as engineers track equipment across a hospital network, public health nurses monitor patterns across populations, always looking for the weak points before they turn into crisis. At its heart, public health nursing is about scale. It's the same compassion and precision you see in bedside care, but multiplied, to protect not just one person, but thousands. School nurses hold a unique place in healthcare, right at the intersection of education and medicine. Their mission is twofold: to provide preventive care and health education for students and to step in when health problems arise. A child with food allergies may rely on the school nurse for emergency treatment. Another with asthma may need help managing inhalers during the day. For many families, the school nurse is the first line of defense when health disrupts learning. But their role is also bigger than emergencies. School nurses teach students about nutrition, hygiene, and healthy habits, planting seeds of healthy literacy that last long after graduation. They usually work for school districts or partner organizations, becoming trusted figures in the community, often remembered for years. If public health nurses serve whole communities, school nurses focus on the microcosm of a school, shaping health one child, one classroom at a time. And if we think in engineering terms, they're like on site safety monitors. Just as biomedical equipment technicians keep equipment functioning in the environments where it is used, school nurses keep students safe in the environments where they learn and grow. Occupational health nurses work at the intersection of healthcare and the workplace. Their job: to keep workers healthy and safe. Sometimes that means treating injuries on the job like cuts, strains, or chemical exposures. Other times it means monitoring workplace conditions, from air quality to ergonomics, and advising business leaders on how to prevent harm before it happens. These nurses often need expertise in toxicology, occupational hazards, and public safety because their patients aren't just individuals. Their patients are an entire workforce. You'll find them employed by companies, organizations, or government agencies, acting as both caregivers and consultants. The parallel to engineering is striking. Just as biomedical engineers test, monitor, and advise on the safety of equipment, occupational health nurses test, monitor, and advise on the safety of environments where people work. Both roles are proactive, preventing harm before it disrupts lives. In the end, occupational health nursing reminds us that healthcare doesn't stop at hospitals. It reaches into factories, offices, and fields, protecting workers so they can keep doing what they do best. Nursing often involves more than observation, teaching, and comfort care. Many nurses are trained to perform invasive procedures, hands on interventions that go directly into the body to diagnose, treat, or stabilize patients. These include giving injections, whether it's a flu shot, a pain medication, or a life saving therapy. Nurses also start intravenous lines, the gateways for fluids, medications, and nutrition. They may insert Foley catheters to drain the bladder, or suture cuts in emergency or clinical settings. In critical situations, nurses manage patient airways, ensuring oxygen gets where it's needed. And for patients who can't swallow, they may insert nasogastric tubes to provide nutrition or remove stomach contents. Each of these procedures requires not just technical skill, but also steady judgment and communication, because patients often feel anxious or vulnerable during invasive care. Think of it like an engineer handling sensitive adjustments inside a complex machine. One wrong move could cause harm, but with training and precision, the procedure restores function and safety. Invasive procedures highlight the nurse's dual role, both technician and caregiver, balancing the science of skill with the art of compassion. Education administration is one of the most critical and most high risk responsibilities nurses carry. In fact, nurses are the health professionals most likely to give medications directly to patients. That's why they allow what's known as the five rights of medication administration. First, the right patient, confirmed by checking the patient's wristband and asking them to state their name. Second, the right drug, matching the label to the prescription, no assumptions. Third, the right time, not early, not late, but exactly as prescribed. Fourth, the right dose, checking the order and double checking calculations, especially for high risk drugs. And fifth, the right route, making sure the prescription says whether it should be taken orally, injected, inhaled, or given another way. Picture a nurse on a busy ward, alarms sounding, patients asking for help, the phone ringing. Even in the middle of that chaos, the nurse slows down the medication cart, going step by step through the five rights. Why? Because one small mistake could have life threatening consequences. In engineering terms, it's like a pre flight checklist. Before a plane takes off, every system is checked, not because mistakes are expected, but because mistakes can't be allowed. Nurses approach medication administration with the same discipline, methodical, careful, and precise. Because in this moment, the margin for error is zero. Even with the five rights of medication administration, errors still happen, and they can be devastating. Some errors start at the very beginning with ordering and prescribing. A prescriber might be overworked or distracted, missing key details. They might be unaware of a patient's allergies or potential drug interactions, or the prescription itself is incomplete or illegible, leaving room for misinterpretation. Other errors occur during IV administration, which is particularly vulnerable because of the complexity of doses, pumps, and timing. And finally, errors can happen at the point of administration. A nurse who is tired, interrupted, or juggling too many tasks might make a mistake. Sometimes it's not human error at all, but equipment failure. An infusion pump that malfunctions or a barcode scanner that doesn't work properly. Imagine the scenario. A nurse on a busy unit starts an IV medication, trusting the infusion pump to regulate the dose. Midway through the shift, the alarm fails. Without a safety check, the patient could receive too much too quickly. That's why awareness matters. Nurses, prescribers, and engineers all share responsibility for catching weak points before harm occurs. In healthcare, even small slips, a misread order, a faulty machine, a distracted moment can ripple into life threatening consequences. The culture of safety depends on vigilance, teamwork, and systems designated to protect both patients and providers. We've talked about how medication errors happen. Now let's focus on how to stop them before they reach the patient. Prevention starts with standardization, making sure medication labels look the same so there's no confusion at the bedside. Many facilities also rely on pre measured doses for common medications, which removes the need for complex math in high stress situations. Education is another safeguard. Nurses receive drug safety training and tools like dose calculation worksheets, so they have confidence in every decision. Technology also plays a major role. Barcodes on medications allow nurses to scan both the patient's wristband and the drug, confirming the match before a single pill is given. And advanced systems can track and report timing, ensuring medications are delivered exactly when they are needed. No more guesswork, no more missed doses. Picture this: a nurse scans a barcode at the medication cart. Instantly, the system flashes a warning: the patient is allergic. That split second alert prevents a potentially deadly reaction. It's the same logic engineers use with fail safes in medical devices: alarms, backups, and checks built into the system. Because no matter how skilled the professional, everyone is human, and good systems are designed to catch human error before it becomes human harm. In nursing, if it isn't documented, it's as if it never happened. Documentation is a thread that ties the entire nursing process together. Every step must be recorded, starting with patient information: symptoms, observations, medications given, treatments performed, and most importantly, how the patient responded. These details aren't just notes, they're the story of the patient's care. Documentation also carries communication with other providers. Did the primary care physician review the chart? Was a specialist consulted? Were follow up appointments scheduled? All of this becomes part of the official record. And finally, nurses document their own actions: what was done, when it was done, and why. Picture this: a patient's blood pressure drops suddenly. The nurse administers medication, calls a physician, and rechecks vitals. Without thorough documentation, the next shift may not know what happened, or worse, may repeat a treatment unnecessarily. It's not just about memory, it's about continuity, accountability, and safety. Engineers know this too. Biomedical equipment technicians document every inspection, repair, and calibration so the next person who touches that device understands its history. Documentation, whether in nursing or engineering, is about creating a living record that keeps people safe and systems reliable. Good documentation isn't just about writing things down, it's about making the record useful for everyone who comes after. That starts with clarity. Records should be clear and comprehensible so another nurse, a physician, or even a lawyer years later can understand exactly what happened. Accuracy is just as important. That means using approved abbreviations, never made up shortcuts. It means writing in a way that's objective, clear, and specific and concise. Not vague notes like patient doing better, but concrete details like blood pressure decreased from 150 over 95 to 125 over 80 after medication. When mistakes happen, and they do, they should be indicated appropriately. No erasing, no covering up. Late entries should be marked clearly so the timeline of care stays accurate. Today, electronic health records help standardize this process. They provide prompts, reminders, and structured fields that reduce ambiguity and keep the patient's record complete. Imagine a patient being transferred to another hospital. The chart is their story. Every symptom, every treatment, every response. If that story is vague, incomplete, or confusing, the new team may not know what's been tried, what worked, or what to avoid. Clear documentation ensures continuity of care. It's much like engineering logs. When a technician records the service history of a device, the next person can step in and immediately understand what was done, what problems were found, and what still needs attention. Both systems rely on records that are accurate, objective, and trustworthy. Today's nurses don't just rely on stethoscopes and thermometers. Technology is woven into nearly every part of their work. On the front lines of patient care, nurses use feeding pumps to deliver nutrition safely, suction equipment to clear airways, and barcoded medication systems to ensure patients get the right drug at the right time. They regulate oxygen, monitor patients through telemetry, and use automated compression devices to prevent blood clots. Technology also protects nurses themselves. Mechanical lifts help them safely move patients, reducing the risk of back injuries that have sidelined so many caregivers in the past. And beyond the bedside, digital tools shape the flow of information. RFID tags track equipment and supplies. Video conferencing allows remote collaboration, and electronic health records provide a living, shareable story of each patient's care. Imagine a nurse is managing the critical ill patient. A glance at the telemetry monitor shows heart rhythm changes. At the same moment, the infusion pump alarms signals a blocked IV line. With training and technology, the nurse quickly interprets both signals, solves the problem, and stabilizes the patient. It's the same synergy engineers depend on. People and technology working together. Machines provide precision data, but it's the human professional who brings judgment, compassion, and context. Technology has transformed nursing, but it's not always smooth sailing. Sometimes the problem is poor decision. A machine may be too complicated with buttons that aren't intuitive or alarms that sound the same for every issue. Other times the problem is poor implementation, system integration. A new electronic record system may not communicate with the old one, forcing nurses to duplicate work. And of course, there's poor maintenance. Equipment that breaks down isn't updated or fails when it's needed most. But there are solutions. One is to involve nurses in technology selection. After all, they are the ones who will use it every day. Another is to implement technology in stages, giving time for training, adjustment, and troubleshooting. And perhaps most important, nurses must be taught how to monitor technology itself, not just trusting the machine, but knowing when to question it. Picture a nurse in the ICU watching a monitor that shows stable vitals, but the patient doesn't look stable. Because she knows the equipment, the nurse realizes the lead has slipped. not the patient's health. That judgment only comes with training and confidence. In the same way, engineers know that even the best designed systems needs user input. They need stage rollouts and constant maintenance. Nursing and engineering share this truth. Technology is powerful, but only when people and machines work together with safety as the ultimate goal. You've journeyed through the routines and procedures that shape nursing, from acute and ambulatory care to long term, home health, school, public health, and occupational nursing. We've seen how nurses give medication safely, perform invasive procedures, document every step of care, and rely on technology to extend their reach. What ties all of this together is one truth: nursing is both universal and unique. Universal because every nurse, no matter the setting, must ensure medications are given safely, documentation is clear and accurate, and technology is used wisely. Unique because each environment, from the ER to the classroom, brings its own challenges, rhythms, and responsibilities, and nurses don't do this work alone. They partner with physicians, engineers, technicians, families, and patients themselves, building a culture of care where safety and compassion work hand in hand. So, whether it's starting an IV, charting a symptom, catching a medication error, or troubleshooting a piece of equipment, nurses carry a wide range of responsibilities, all anchored by one goal: to protect patients and improve health wherever care takes place. This is the essence of nursing care processes: careful, deliberate, and always human. As we close, let's bring the big picture of nursing care processes into focus. Part 1 is the foundation. There are three main types of nurses: LPNs, RNs, and APNs. Each brings a different level of training, responsibility, and expertise, but all are grounded in patient care. And beyond direct care, nurses take on roles in teaching, research, and administration. What unites them all is the need for formal training, passing a national exam, and meeting state requirements, ensuring competence and accountability. Part 2: Clinical Judgment. At the heart of nursing lies the five-step nursing process: assess, diagnose, plan, implement, and evaluate. Nurses apply clinical judgment at each stage, balancing evidence with compassion. And they don't just heal bodies, they also protect patients' legal rights and advocate for safe, ethical care, playing a key role in improving quality across the healthcare system. Part 3: Responsibilities in every setting. From hospitals to schools, clinics to homes, nurses work in a wide variety of environments, each with unique challenges, yet certain responsibilities are universal: to administer medications safely, document care carefully, and use technology wisely. These are the anchors of safety, no matter the setting. So, whether a nurse is starting an IV in an emergency, teaching a family about long term care, or documenting a patient's recovery, the goal is the same: safe, effective, compassionate care. And in the big picture, nurses are not just participants in the culture of healthcare, they are its backbone. Their judgment, precision, and advocacy shape outcomes not just for individual patients, but for entire communities. I want to thank you very much for your time in this series of learning about nursing care processes. We'll see you next in evidence based medicine.